welcome to the Burlington Township School District's Critical Conversations in Our Community series. We are so pleased to have all of you here with us here this evening. My name is Liz Scott. I am the School District's Director of Human Resources and Community Relations. Our district is committed to having critical conversations to address important issues within our community. But before we go any further, I would be remiss if we did not take a moment to pause to remember those that we have lost to COVID. Yesterday, our country marked a somber milestone with the loss of 500,000 souls, and that number has risen today. Each of us has been impacted in some way by COVID. And I just want to take a moment to remember those that we have lost. So please join me in a moment of silence, please. Thank you. In Burlington Township, we have committed to having critical conversations that may make some people uncomfortable. But in the case of tonight, we're going to have a conversation that may actually help save some lives. Tonight, we open this critical conversations to people everywhere outside of Burlington Township, and we have registrants from Maryland, Pennsylvania, New York, Delaware, and we're very pleased to welcome you to the state of New Jersey. But we wanted to try to do our small part to help move our society forward in this fight against COVID-19. Our program tonight, COVID-19, the vaccine, the distrust, the facts. We'll try to make strides to answer questions that people have about the vaccine and about COVID, and more importantly, to educate people about the vaccine and encourage people to get vaccinated, especially people of color. COVID-19 has devastated people of color everywhere. The infection rate, the death statistics are just mind-blowing. And it is our intent tonight to provide a forum to raise awareness and provide valuable insight into this battle that we are all fighting. So at this time, it is my pleasure to introduce our Superintendent of Schools, Mrs. Marianne Bell, to provide a welcome. Mrs. Bell?
Thank you. Good evening, everyone. I want to warmly welcome everyone to tonight's program. Whether you're joining from Burlington Township or Burlington City or outside of the Burlington area, we are glad that you are here tonight. I also want to recognize Mrs. Liz Scott, who has engaged Burlington Township in critical conversations all year. These deep conversations are so important right now. And tonight, we have an esteemed panel of experts to help us navigate a timely topic on the COVID-19 vaccine. As we try as a society to move forward, the vaccine will prove important to everyone. We live in an amazing time when scientists were already working on coronavirus vaccinations that allowed for the emergency deployment of this vaccine in an amazing amount of time. So I want to thank our panel for their time and their expertise tonight. And I especially want to thank Mrs. Scott for her leadership in these conversations all year long. And I want to thank everyone who is taking time to join us tonight for this important session. Thank you.
Thank you, Mrs. Bell. So the response, as I said earlier, to this program has been phenomenal. And our attendees are encouraged to use the chat feature throughout the evening to submit your questions for our panel. Our early registrants were able to submit questions in advance. We have gone over those questions and we will answer them. And we will try our best to get to as many questions as possible as they pop up in the chat. Tonight, we have an amazing panel who will share their thoughts. They are going to share their experiences as it relates to COVID. They will also share valuable information and facts in an effort to debunk the misinformation that is floating around on social media and in the internet. Our panelists will be introduced and they will reflect on why they agreed to participate tonight and what they hope to accomplish and gain from this critical conversation, while also sharing their experiences with COVID-19 and the COVID-19 vaccine. Following the panelists' reflections, our special guest keynote speakers from the Burlington County Health Department, Dr. Holly Funkhauser Kukazela, and Director of Health Education, Dr. Zupinda M. Davis Shine, will speak on Vaccine 101 and address the myths and provide some very important facts. Following their keynote presentation, we will get involved in a guided panel discussion, followed by answering the questions that have been submitted to us. At this time, I would like to introduce my co-moderator and my friend, Ms. Katina George, who is the Director of Counseling at the Burlington Township School District. Katina?
Hi, everyone. Thank you so much for joining us tonight. I am actually very happy to be here because I'm learning a little bit more and more about the COVID-19 vaccine as we talk a little bit about it throughout the evening. But my part right now, I'm going to give you a little background on why there's such a distrust within the Black and Brown and Latinx communities. I'm going to give a brief overview of the Tuskegee study, which started in 1932 and lasted 40 years. Initially, the study began to record the natural history of syphilis and hoped to justify treatment programs for Black men. The study involved 600 Black men, 399 with syphilis, and 201 who did not have the disease. The study was conducted without the patient's informed consent. The patients were told they were being treated for quote unquote bad blood, which was used to describe several different ailments, which included syphilis, anemia, and fatigue. The men agreed to be examined and treated for the ailments. However, they did not receive the proper treatments needed to cure their illness, even when penicillin became the drug of choice to treat syphilis in 1947. So it continued on for almost 30 years. In the end, the men did agree to be examined and treated, but there was no evidence that they were informed of the true purposes of the study. And in fact, they were misled. In the 1950s, the first human trial of the birth control pill was launched in a public housing project in Puerto Rico. This was before the pill was deemed safe in the mainland of the United States. These women were never fully informed of what they were participating in, and many suffered permanent consequences because of the trial. These are just a few examples of the medical studies targeting our Black and Brown and Latinx populations as guinea pigs. So these unspeakable and inhumane trials, especially the Tuskegee experiment, which lasted until 1972, remains in the minds of many who have not forgotten. This is why we are here tonight, to have this critical conversations and to give information. So at this point, I'm going to introduce some members of our panel. Our first panelist is Elder Winton Dunham. Elder Dunham is a dispatch supervisor and an assistant pastor and district elder. In both positions, he feels led to serve others, whether through assistance and selecting products or navigating their spirituality. Elder Dunham focuses on giving, sharing, helping, and guiding all others in all that he does. Currently, he serves as the chaplain with the Burlington City Police Department, where he has been able to offer support, counsel, and prayer for those experiencing loss, frustration, grief, depression, and life-altering crisis. So we want to thank you for all that you're doing, because I know right now things are not easy. Elder Dunham is an avid reader, devoted husband and father, and has been impacted by COVID. No matter what, he is covenanted to fervently pursue a spirit of excellence in all that he is designated to his charge. Elder Dunham, I have a question for you. Why did you agree to participate in this conversation, and what do you hope to accomplish during this critical conversation? And what is your number one message to everyone about the vaccine? So it's really like a three-part question for you.
I'll do my best to cover them all. Before I get started, first, let me say thank you to Burlington Township School System and to Mrs. Scott and Ms. George for your moderating this program, and just for your courage to have these critical conversations to address people's concerns. And I think that people are certainly having real fears and struggles. And so platforms like this provide opportunity to kind of get those things in the open, and hopefully what we're able to do here tonight will set some of those fears at ease. I certainly am just humbled by the opportunity to be able to share on tonight. It's certainly important, especially on the heels of what you just laid out for us concerning the history of how many Black and Brown people view their fears concerning or mistrust concerning the medical profession from a historical standpoint, which is probably the main reason why I'm here. I understand that experience, and there is a certain inherent mistrust that's just handed down based on that history, and I certainly understand that experience, and I think that is something that I certainly have, um, just talking to people every single day. They certainly voice those fears and concerns. For me personally, I have been a person that since the beginning of COVID-19, I've been out every single day. I've been at work every single day, which requires me to leave my home every single day. And so really it becomes a question in terms of exposure, not if, but when. Are you going to come in contact with somebody? And you're more than likely each time that you go out that you will. And so it's about all those safety precautions and doing whatever you can do. So when the opportunity was presented to me concerning vaccination, certainly be honest. I don't do vaccines. I've made that statement before. I think that's probably one of the main reasons why I'm here. My wife and I discussed it, our family discussed it, and it was not something that we were certainly signing up for or enthusiastic about. But ultimately, you have to be willing to educate yourself about what the vaccination is, what it does. Also understand the critical crisis that we're in right now in our country, and it's really out of control. Those numbers that Mrs. Scott mentioned right when we opened this program, over 500,000 people who have lost their lives to this virus. It is of the utmost importance that we are doing all that we can. So it caused me to take another look and to educate myself. My first thing that I have to look at was that I'm always under the impression that when you're vaccinated for something, that they're going to give you the very thing that you're supposed to be trying to prevent. That's usually how the flu works and things like that. To learn that that wasn't the case was certainly something that was reassuring for me. But then when it comes to those concerns about being quote unquote test subjects, based on the history with Tuskegee and so many others, I was also enlightened to know that actually a young African-American doctor was at the forefront of the creation of the vaccine itself. And certainly that was reassuring. I say young because she's younger than me, and that means I'm still young, so she's got to be young. But that was certainly something that was news to my ears. And then it's reassuring to let you know it's something worth looking at. But we have to get a handle on it. And so just based on those factors, I actually have already taken both vaccine shots, my first and my second. And I'm still here. My wife was commenting she didn't know whether I was going to have a sixth toe. I have still 5 toes, 5 fingers, everything's in working order, and I'm all well. And I really want to the thing that I hope to gain more by tonight, I'm hoping I'm not too long, but I hope to gain by tonight is to be just a witness that it's safe and that it's something that is beneficial, especially for people of color, as we have been devastated so much. And so I wanted to show my face and just be living proof that it is something that we should all consider for our own, so we can address the public health crises, but ultimately we're concerned about ourselves and our families. And so I want to encourage you to do that. You're still on mute, Mrs. Scott, if you're talking.
Thank you. You didn't hear everything I just said about you. I just wanted to say thank you so much for those words. Everything that you said just really hit home, and I just know that you have touched someone out there who had some hesitancy, and being a man of color, I'm sure that your words have definitely resonated with other men who are in attendance tonight. So thank you, and we look forward to hearing from you a little bit later. Now it's my pleasure to introduce Mrs. Kelly Warren. Kelly is a master's prepared registered nurse at Virtual Health Memorial Division. Nursing is Kelly's second career and her first passion. She started her nursing schooling career at the Burlington County College, where she received her associate's in nursing and passed her boards in 2007. She began working for Virtual Health and subsequently went back to school to obtain her bachelor's in nursing at Purdue Global University to become more prepared in research and community health. She completed her Master's of Science degree in Education at Grand Canyon University and continues to study, recently changing her terminal degree from Doctors of Nursing Practice, DNP, to doctoral candidate for her PhD in Industrial and Organizational Psychology. You go, Kelly. Kelly's desire is to continue to advance the profession of nursing through research and advocacy, specifically addressing healthcare disparities affecting minorities. When she's not at work as the nurse manager at Virtual Memorial Surgical Services, Kelly is a wife to the Reverend Mark Warren, mother of 5 girls, and the worship leader of creative arts at the Tabernacle Baptist Church. She is affectionately called the Vaccinator, and she also has been impacted by COVID. So, Mrs. Vaccinator, why did you agree to participate in this conversation, and what do you hope to accomplish during our discussion tonight? And what's your number one message to everyone about the vaccine? Kelly?
Thank you, Liz. Thank you. Thank you all for being here tonight, and it's my pleasure to be here tonight. I agreed to be on this panel first and foremost because I am a African-American female. I am a vaccinator, and I have been vaccinated. So I felt that I was a representative of all those questions that are out there. Being a minority, also being a healthcare worker, I vaccinate people every week, and I have also been vaccinated. So I felt that I was kind of the poster child for all of the concerns and a resource for people. I hope to be a resource because of all those reasons. I hope to be a resource for some of the participants tonight if they need to ask me any questions personally or from a professional perspective. And the main thing I want to, for the participants to get out of it tonight, or for me to get out of it tonight, is the facts and not the myths that are out there on social media. And our panel of esteemed professionals here can clear those up for everyone.
Thank you, Kelly. Katina?
Thank you, Kelly, the vaccinator. Appreciate that. I love it. Okay, so next we would like to introduce both our keynote speakers who will share their expertise with both being directly on the front line of the COVID battle. First, Dr. Zupenda M. Davis-Shine, who is the Director of Health Education at the Burlington County Health Department. In this role, she supervises all health education and promotion activities and events for Burlington County. She plays an integral part in the health department's COVID-19 response by disseminating public health messages focused on prevention, testing, and the vaccine. She also serves as the county's health educator and risk communicator. She holds a doctorate in public health from Drexel University with a concentration in community health and prevention. She received her MPH from UMDNJ School of Public Health, which is now Rutgers School of Public Health, and her BS PH degree from Rutgers University. She is also a Master Certified Health Education Specialist and a trained domestic violence advocate. Dr. Shine has over 25 years of experience in public health, program development, and strategic planning. She has worked in various sectors, nonprofit, academic, research, and local government, and her areas of expertise include HIV and AIDS and domestic violence prevention. Prior to joining the Health Department, Dr. Shine served as the director of the Bachelor of Science in Public Health program and an assistant professor of public health at LaSalle University. She has held previous positions at Health Federation of Philadelphia, Southern New Jersey Perinatal Cooperative, New Jersey Primary Care Association, and the University of Pennsylvania. Dr. Shine is a member of the American Public Health Association, National Association of Health Services Executives, Delaware Valley Chapter, and Sigma Gamma Rho Sorority, Epsilon Zeta Sigma Chapter. Liz, you want to ask? Go ahead.
So I'm going to introduce our next keynote speaker, and then they are both collectively going to answer the question. So Dr. Holly Funkhauser-Cucuzella is the health officer for the Burlington County Health Department, serving the 4 municipalities in Burlington County. She has worked for the BCHD for the last 19 years. In this role, she guides all of the public health programs, including communicable disease investigations, food inspections, air and water pollution programs, the WIC program, and the Burlington County Animal Shelter. Most of her time these days, though, have been spent on the county's COVID response. Dr. Cucuzella has experience working as a health educator, risk communicator, epidemiologist, and clinical research coordinator. Previous employment includes the Massachusetts Department of Health and the McGuire Veterans Affairs Medical Center in Richmond, Virginia. In addition to her work at the health department, she is an adjunct faculty at Rutgers University, Stockton University, Fairleigh Dickinson University, and Thomas Edison University. She obtained her bachelor's degree in biology with a microbiology concentration from Virginia Tech, her master's of public health from the Medical College of Virginia, Virginia Commonwealth University. She earned her doctorate in public health and community health and prevention from Drexel University. Dr. Cucuzella is a member of the NACCHO, the New Jersey Association of City and County Health Officials, the National Public Health Information Coalition, and the New Jersey Society for Public Health Education. We are so excited to have both of you. And we want you, when we turn the floor over to you, to share with us, ladies, why you agreed to do this presentation, what you hope to accomplish through this critical conversation. And then we're going to ask you to share your presentation with our attendees. So without further ado, I introduced everyone, Dr. Zupinda Davis-Shine and Dr. Holly Funkhauser-Cucuzella. The floor is yours.
Okay, so hi, everyone. I am very thankful to be here. And I just wanted to say that, I agreed to be a part of this conversation because it's very important. It's timely and things keep changing on a daily basis regarding the COVID pandemic as well as vaccines. So what I want to accomplish is to just get out timely, reputable information. And my key message is that to everyone is that getting vaccinated is a personal decision. I just want people to make an educated decision that's based on factual and reputable information.
Thanks, Zupinda. So thanks to Liz and the school district for having me. I am a township resident, so I'm more than honored to be a part of this presentation with 2 in-township schools. So thank you for having me. For me, the decision to be a part of this really goes down to my work over the last now 365 days working on COVID. And one of my jobs every day is to look at the numbers. I see the names of everybody affected by COVID. I've seen the names of every individual in Burlington County that has passed away from COVID. I have talked to their families. And so it's a very personal thing for me now. And so I want people to know the facts and to make that educated decision about getting vaccinated, because vaccines save lives. They've been proven for decades, centuries now, that vaccines save lives. And this is no different. And this one more than ever is meant to save lives. So the goal for Zupenda and I today is to kind of lay out all the information, all the facts, and that way when the presentation's over, you can leave and make an informed decision about vaccines. So I'm going to attempt to share my screen. All right. Okay, can you see my slides? Yes, okay. All right, so I am going to begin today just kind of giving you an overview of the vaccine, and then Zupenda is going to talk about the myths and the facts associated with the vaccine, and then wrap up with kind of where we stand right now with the vaccine campaign in New Jersey, specifically Burlington County. So I really wanted to start by talking about the COVID cases and where we are, where we were, where we went, and hopefully where we're trending now. As of right now, in Burlington County, we have topped 30,000 cases, which I never would have thought at the beginning of this, we would have hit numbers like this, but unfortunately we have. And if you add in the probable cases, we're closer to about 35,000. We are only 2 deaths shy of 700 deaths. And I can tell you there's going to be, these numbers are all from yesterday. And when I did the numbers late this afternoon, there were 4 more deaths. So we have topped 700 deaths here in Burlington County. And originally, the cases in the beginning, did skew to the older demographic and to the long-term care facilities, but we don't see that anymore. It's almost like a 50-50 split. We've seen individuals as young as 40 pass away from COVID to as old as 102. So it really doesn't matter right now, the age group. We still do see older, but we're seeing just as many younger individuals now as well. I pulled out, I know we have individuals outside of Burlington Township, and all of this data is available on the Burlington County Health Department website. In Burlington Township, we are approaching 2,000 cases, and we did hit 100 deaths within Burlington Township alone. One of the things with COVID that the buzzword that a lot of people have heard is contact tracing. And that's when an individual calls you to, one, either if you're positive, to investigate possibly where you could have gotten it, who have you been in close contact with, and to provide quarantine and isolation instructions. Then once they provide that list of people they've been in close contact with, we reach out to those people that they have been in close contact with to tell them that they need to quarantine. We still are running into a lot of individuals that don't pick up the phone, that don't want to cooperate with us. And really, unless we can get people to quarantine, it's very hard to stop the spread. Because the idea is, if somebody is positive and you've been in contact with them and you go into quarantine, by the time if you test positive, you've been in quarantine, the goal is that you haven't exposed anybody. So then there's not additional cases popping up. So that's why it's so important to answer that phone if a contact tracer calls, so that we can use that as one method for controlling the spread. The good news is things are improving. From the start of the year, if I go back a few slides, this slide here, these are the number of positive cases. Number of new cases that we've had since basically the beginning, where we had a peak late spring. We over the summer, we were at kind of our lowest numbers, and then around the holidays, we really saw that surge, and we're starting to come down. But we need everybody's help to keep it going down by continuing to follow those good public health prevention methods of masking up, social distancing, and staying outside of crowded spaces. But things are improving, and we hope that they continue to do so, especially as individuals choose to get vaccinated. But just because we're vaccinating doesn't mean there's still not a need for testing. Testing has decreased significantly, which does lead to lower numbers, but we still want people to know that testing is available. Testing is available free of charge at the county clinic. Our county clinic is at RCBC in Mount Laurel. No insurance is required. We will collect it to bill the insurance, but you will not get a bill. If there's any difference, the county picks up the cost. It can be you can be symptomatic or asymptomatic. You do not need a prescription. And generally, we want people over the age of 6 because it's the saliva test, and it's very hard for the younger children to be able to produce that amount of saliva needed for the test. We have had younger kids come in, but it takes them a really long time to be able to produce that kind of saliva. So we do have county testing available at RCBC. Next week, we are going to be changing our hours a bit due to the demand in testing, but we will still offer testing on Tuesday, Wednesday, and Thursday. Tuesday and Thursday, it'll be 9 a.m. to 12 p.m. We do offer priority testing for first responders from 8 a.m. to 9 a.m. And then Wednesday, 12 p.m. to 4 p.m. Is when our testing will switch starting next week. Generally, results come back in about 24 to 48 hours. It depends upon how busy the lab is, but most people usually get results next day. So it's a pretty quick turnaround time. Now, for individuals that cannot get there during that time period or might be homebound or have transportation issues, we do offer a home test. And it's available at homecovidtest.org. The whole process takes about 72 hours. Basically, you apply on that website, we approve you, you get a code, you put the code into a website to order a kit. The kit gets overnighted to you, you do a Zoom call with a provider, and you overnight it right back. So it's a pretty quick process. It's also the saliva test. Right now it is limited to 1 per email address. But if we see, because originally this test is more expensive. And so in the beginning, there was a huge demand for it. But as the demand lessens, we may look at allowing more per email address as we move forward. There are a lot of additional testing options throughout the county. These are just a few of them. Central Jersey Urgent Care in Browns Mills is the only one that tests 6 months and older. So if you do need one for an infant or, a small child, South Jersey Family Medicine and Central Jersey Urgent Care do test some of the younger children that are for their test. You just want to call before you go to any of these sites because a lot of them they're either by appointment, you have to be symptomatic, you need a prescription. So before you go to any of these sites, you'll want to check with them. But once again, the county site is free, no prescription needed, no appointment needed. It's just walk right on in. All right. So now probably what everybody's been waiting to hear about, and that is the COVID-19 vaccines. Right now, I think everybody knows that there are 2 approved. Pfizer and Moderna are the 2 that have emergency use authorization right now. And it is important to know that, as stated previously, they do not contain the COVID-19 virus. It's not like other vaccines where you're given an inactivated virus. It does not have COVID-19 virus. We are expecting the Johnson & Johnson EUA to be approved for their vaccine over the next couple weeks. And that'll be good news for a bunch of reasons, which we'll talk about. But basically, the Moderna and the Pfizer vaccine are what they call mRNA COVID-19 vaccines. So this is a generally relatively new technology, but it is not brand new. It's actually already used in cancer treatments. So it's not something that was designed just for COVID-19 vaccines. It's been here, it's been used. And basically, I think everybody's familiar with that picture of what COVID-19, and it has that little red thing that comes off of it. And that's what they call the spike protein. And basically what the vaccine does is it tells our body to look for that little spike protein. And once we recognize that, we then can build antibodies against it, right? So it's important to know, though, that the mRNA vaccine does not change your DNA. It does not mess with anything in your body except for you to build antibodies against the COVID-19 vaccine. And it's not going to give you COVID-19. So it's not giving you, sometimes a lot of vaccines give you a little bit of the virus so that you can then develop antibodies against it. That is not what this is. This is a way to look at the vaccine. Is it just finds that little spike protein so your body knows that it's looking for it, and then it can build antibodies against it. So a lot of people, one of the big myths and things that people worry about, well, how come this vaccine was developed so quickly? You know, and sometimes it takes years to develop a vaccine. How come this one was developed so quickly? And really, it was because it was a global effort. There was an unprecedented amount of sharing among scientists, among tech companies, among different government entities, military, all across the globe. And because of that, everybody kind of pulling their collective resources together, it allowed that technology to be shared to develop the vaccine. But that doesn't mean that it's unsafe. The FDA used the same strict standards that it always has put in place. No steps were skipped. It was reviewed by 2 independent advisory committees. And basically, the individuals that were part of this committee had to sign conflict of interest statements. So they don't have any financial stake in either of the companies or any of the companies that they approve the vaccine. So they're not going to benefit financially from it by approving these vaccines. They're strictly looking at the data that's presented to them on whether or not the vaccines are safe. So basically, from the minute it started to be tested, and there's different phases in clinical trials for things to be tested, and safety is the number one thing along the way. And a lot of those safety protocols that are put in place were put in place because of the Tuskegee study. The Tuskegee study mandated what they call institutional review boards. So when you're doing a clinical trial or a study, you have to put in all these different safeguards to protect the individual being studied. And so that is the number one priority when they're looking at vaccine safety and efficacy, is making sure that no harm is coming to the individual. And so they're still continuing to study the safety of the vaccine. And they have to study, I believe it's for at least 2 years out. So all those individuals enrolled in that clinical trial are going to be followed for 2 years and most likely longer to make sure that there are no long-term side effects, or study any that might be identified as well. But there were a lot of individuals included in the clinical trials, probably more than most clinical trials. So the Pfizer had over 40,000 people in the clinical trial. The Moderna had over 25,000. And they did try to make the clinical trials as diverse as they can. But as mentioned before, because of the Tuskegee study, it's very hard to get minority individuals to enroll in clinical trials because of that history. So it doesn't exactly match, the exact percentage of breakdown in terms of race and ethnicity to the general population. but there was a concerted effort to try to make it as racially diverse as possible when studying the vaccine. And also looking at older, because we know that older adults are more susceptible to COVID-19. And so they wanted to make sure they studied the vaccine in that population as well. So what does EUA mean? A lot of people think that emergency use authorization means that it was done too quickly and that the vaccine's not safe and that they rushed it through. And it does not mean that at all. It is a shorter process, but no steps are skipped. A lot of times they did things simultaneously instead of maybe doing this exact step and this exact step. One after the other. They did things that could be done at the same time to move it on. And generally, once again, it was reviewed. And so they do not issue an EUA unless they are comfortable with the safety of the vaccine in the general public. All right. So we get the question about how effective are the COVID-19 vaccines, because this is one of the main things that was studied in the clinical trials. And right now, Pfizer is considered to be provide 95% protection 14 days after your second dose. And for Moderna, it's 94.1% or 94% against COVID-19. Once again, 14 days after your second dose. And we have seen, based upon the clinical trials, the same efficacy, whether was no different by race, ethnicity, or age. So sometimes we have seen vaccines that might have a lower efficacy the older you get, but we didn't see that with the COVID-19 vaccines. But most importantly, this efficacy rate only occurs when you get that second dose. So with Pfizer, you get a second dose 21 days later. And with Moderna, you get the second dose 28 days later. Now, you want to try to get it as close as you can to that date, but there is leeway to get it after if you need to delay the second dose. They don't want you to do it too early, but you are allowed to go after. There are people that do develop COVID-19 after getting the first vaccine because you're not 100% protected. And you might have been exposed before you got the vaccine, or you could have been exposed after you got the vaccine and didn't have, the proper levels of protection from the vaccine at that point in time. We've seen people develop COVID-19 in between the two. Once they're done their COVID isolation, then they're eligible to get the second dose. And Zupenda will talk about that in a little bit. But the other thing is it's important that you get the same vaccine each time. So if you get Pfizer the first time, you need to get Pfizer the second time. If you get Moderna the first time, you need to get Moderna the second time. The good news with the Johnson & Johnson is that it is only one dose. And so with that, we're waiting to see, if it gets its EUA approval, and that will allow a different vaccine to be added into the mix. Now, I know there's going to be a lot of questions about side effects. Most individuals have to wait 15 minutes after vaccination for observation. Those with the history of severe allergic reactions have to wait 30 minutes. And this is a requirement because it is a new vaccine, and we want to make sure that people aren't going to have a reaction once they leave. Most individuals have little to no side effect with the initial dose. I'm sure all the speakers can discuss, since we've all been vaccinated, we all had different experience. Everybody has a different experience with the vaccine. My initial dose, my arm was sore, and that was the extent of mine. Most individuals report more side effects on their second dose. For myself, once again, my arm was sore, I had a headache, and I was a little nauseous. Zupenda can talk about hers. She had a little bit more of a reaction. So, but in most cases, they're gone in 24 to 48 hours. So a very minor interruption on a way to providing a lot of protection against COVID-19. So the other big question is, When and how long will I be protected by the COVID-19 vaccine? And this is the one thing we don't know yet. This is still currently being studied, is how long does the vaccine give us protection? And because we don't have that long-term data yet, that's what we're waiting to find out. I know there's a lot of questions out there about, will we have to get the shot again? Are we going to have a booster? And the answer is we don't truly know that answer yet, but I would not be surprised if it becomes an annual vaccine, just like the flu shot does, and it changes to match whatever is circulating in the community at that time. But we're not going to have a final answer on that until we have the research and, enough people are vaccinated that we know kind of what the long-term immunity is. All right. So most importantly, if you are vaccinated, you still have to wear a mask. You still have to social distance and do all the things that you're currently doing. Yes, you have an extra level of protection for yourself. But what we don't know is, can vaccinated people pass COVID to non-vaccinated people? And that's something that they're studying. So while, yes, you're wearing the mask to continue to protect yourself because you still only have a 95%, protection rate, it's more about protecting the people around you, especially those that haven't been able to get vaccinated yet. And that's why it's important to still wear the mask and social distance. All right. And we talked about this. The vaccine cannot give you COVID-19. It's going to give you some short-term discomfort that's going to go away. And side effects are good. Side effects mean your body is reacting to something in your body. So that's a good sign that you are building up some immunity. Now, if you don't have side effects, does that mean you didn't get any immunity? No. Everybody's body is different on how they're going to react to the vaccine. All right, so now I'm going to turn it over to Zupenda. And Zupenda, I think you're just going to have to tell me when to click next.
Ladies,
Okay.
can I interrupt just for 1 second?
Sure.
Because a number of questions came in while you were speaking, Holly, and I think we should go ahead and address those and then jump into the next segment. With the numbers from Burlington Township, what percentage of those numbers actually came from the nursing home?
So in the beginning, it was a lot was nursing home. It was almost like a 75-25 split. It was initially large percentage nursing home, large percentage community. As we've traveled through time, they're now about equal. And they might even have switched places a little bit. That now there's just as many community spread as there was in the nursing home. So it switched. So yes, in the beginning, we saw it in most of the municipalities that had a lot of nursing homes. We saw a large percentage of nursing home, small percentage of community. Over time, those things equaled, and in many places even switched.
How effective are the Pfizer and Moderna vaccines against the newer strains of the virus?
So they're still studying that. The preliminary data thinks there is protection against the UK variant. It might not be as high as a percentage, but it's still going to offer enough that you're not going to have the severe disease. They're looking at the South African and the Brazilian strain to determine how effective they are. They don't think it might be as effective, but they don't have enough data truly to be able to tell yet. Right now, there are variant strains in Burlington County. There have been 5 strains of the UK variant identified. And I think statewide, it's about 60 to 70 cases across the state have been identified of a variant strain, but I believe they're all UK at this point in time.
The next question that came up was in terms of the study. Since it was a shorter process, have they had any time to study or understand any potential long-term side effects?
Right. So they're studying the long-term side effects now. So those individuals that started the clinical trials last summer now are coming up on a year. And so they're going to start collect that data for about a year out. But really right now, the long-term side effects, we don't know. Based on vaccine history and what we've seen with vaccines, we don't anticipate a lot of long-term effects, but once again, we don't know that till we have the data. It comes down to, for me, a risk versus a risk-benefit ratio. So do the risks of taking the vaccine outweigh, or do the benefits of taking the vaccine outweigh the risks of not having the vaccine? And knowing the death rate and the cases and the long-term debilitating effects that some people have from COVID infection, for me, the benefits outweigh that risk of the long-term effects that might occur. But they're studying it now to be able to see what the long-term effects are going to be. Right now, none have been reported for this far out into the study for the people that they're following from that initial, phase 1 and phase 2 clinical trials.
What is the typical number of people who are involved in clinical trials?
It depends upon the clinical trial and what they're studying, because sometimes if it's a rare disease, you're going to have a small number versus a large site. I don't really have anything to compare it to. I can tell you when I worked on a phase 1 clinical trial, I had 9 people in my study. So it really depends upon, what medicine you're trying to study. But 40,000 is a pretty good number to have.
Two-part question. What other ingredients are actually in the vaccines, and can the vaccine cause cancer?
So I think Zupenda has a slide where she's going to have the link to where people can find the specific ingredient list to each of the vaccines. They are listed on the website and on the full emergency use authorization document. None of the data has yet indicated that it causes cancer, but I think that would be a long-term thing that they would need to study.
There was also a comment in the chat about remote testing, and just stating that there are citizens who do not have online capabilities to make appointments. There are also people who do not have transportation in order to get to the testing sites or the vaccination sites. And they're basically saying that it is important that something be put in place to address those who have issues in getting to the remote sites. In terms of contact tracing, what kind of phone number are the contact tracers calling from, and do they leave voicemail?
So they do leave voicemails. I do think when Zupenda's speaking, I will find the number. There is a specific number that would come from Burlington County. If it's coming from one of our offices, it usually says County of Burlington. But for our remote contact tracers, they use an AWS line that all has the same number, and they will leave a message.
Okay. I think that covers one set of questions. Why don't we go ahead and jump into Zupenda's presentation, and then we'll go back to the chat.
Okay.
Okay, so I will talk about some myths and give you some facts to dispel those myths. So Holly, I don't know if she's still there or she can move to the next slide, or did she go find the number?
No, I'm here.
Okay.
There we go.
Okay. So couple of questions that people may have. So after getting a COVID-19 vaccine, will I test positive for COVID-19 on a viral test? So the vaccines cannot cause you to test positive on viral tests. And viral tests are used to see if you have current infection. If your body develops an immune response, there's a possibility that you may test positive on some antibody tests. An antibody test basically indicate if you had a previous infection and that you may have some level of protection against the virus. So next slide. Is it safe for me to get a COVID-19 vaccine if I would like to have a baby one day? So people who are trying to become pregnant now or who plan to try in the future, they may receive the vaccine when it becomes available to them. And what we found thus far is that it's unlikely to pose a risk to a person trying to become pregnant in the short or long term. And the vaccines are being studied carefully now, and as Holly mentioned, will continue to be studied for many years. And this is the similar process that other vaccines go through. Currently, there is no evidence that antibodies formed from the vaccine cause any problems with pregnancy, including the development of the placenta. And there's no evidence suggesting that fertility problems are a side effect of any vaccine. And one thing I wanted to point out as well is that the side effects that pregnant people may experience are similar to that if they get a flu shot or a Tdap shot, and those are recommended vaccines for pregnant people. And the American College of Obstetrics and Gynecology, they advocate for pregnant people, that no pregnant people should be excluded. And one thing we do know too is that when you're looking at pregnant people that may either be infected with COVID or get the flu, they're more likely to experience ill effects such as preterm birth or hospitalization. So it's important that, again, we look at the benefits of getting the vaccine outweighing the risks. Can I get vaccinated against COVID-19 while I'm currently sick with COVID? So people with COVID-19 who have symptoms, they should wait to be vaccinated until they have recovered from their illness and have met the criteria for discontinuing isolation. And Holly has some slides after I do to talk about what those times are. And individuals who do not have symptoms, they should also wait until they meet the criteria before getting the vaccine. And there's also some guidance that applies to individuals who happen to get COVID before getting their second dose. And she had mentioned that. One thing to be mindful of as well is that if you already had COVID, you can still get vaccinated because you don't know how long you're going to be protected from getting sick again after recovering from having COVID. Now, in the event that you were treated for COVID with monoclonal antibodies or convalescent plasma, they recommend that you wait for 90 days before getting the vaccine.
So Panda, I just want to, because I think there was a question in the chat about
Okay.
About some people say you have to wait 90 days after a COVID infection in order to get vaccinated. The guidance says that the theory is that you actually, after a COVID infection, it's thought that you might have immunity, some immunity for up to 90 days after that infection. And so that's why if individuals want to wait to be vaccinated, that's where the 90 days come in. They can wait the 90 days because the theory is that you probably have some natural immunity for that 90 days, but you don't have to. There's no contraindication for a time period for after a COVID infection to get vaccinated. As long as you're outside of your isolation period and you're no longer symptomatic, then you can get vaccinated.
Thank you.
The individual who put the question in chat also just commented that they had the infusion at Virtua.
So I believe there is some waiting periods with either the infusion or the remdesivir. So that you're going to want to check with your provider and the individual vaccinating you before you get vaccinated. I know we had an individual that had remdesivir when they came to our clinic. And when we talked to our medical director, he did have us wait a month to vaccinate that person. So that is, if you have been treated, you will want to just confirm before you do get vaccinated.
So this is a question that a lot of people have. What is in the COVID vaccine? So the ingredients in the vaccine currently include the mRNA, which we talked about, lipids, salts, sugars, and buffers, which help to maintain the stability of the pH solution. And these vaccine ingredients can vary by manufacturer. They are similar, though, when you look at the EUA for Pfizer and Moderna. The available COVID-19 vaccines do not contain eggs, preservatives, or latex. And I provided links in the slide to learn more about the ingredients. All the information about what the ingredients are listed. It's public information. So there's links for CDC. And even if you were to Google Pfizer EUA or Moderna EUA, it will bring you to an EUA fact sheet for recipients. If you read that, it will talk about everything from the ingredients, side effects, and more. Now, what about if you have an underlying condition? Can you get a COVID-19 vaccine? So people that do have underlying medical conditions can receive the vaccine as long as they have not had an immediate or severe allergic reaction to the vaccine or to any of the ingredients in the vaccine. And I'll talk about that in a couple of slides. And it's basically something to really consider. If an adult of any age has any particular underlying medical conditions, because they are at an increased risk for severe illness from COVID-19. And I also wanted to add too, just in general, if you do have any type of particular medical conditions, to just have that conversation with your doctor prior to getting the vaccine. That way you can have that dialogue and that conversation to help you make that decision if that's the best thing that you should do. So for individuals who may have a weakened immune system, and this may include people that have HIV, they may receive the vaccine. However, it is important to know that there is limited safety data at this time. But, so the information about the safety of the vaccine for people in this particular group is not yet available, but they may receive the vaccine. And again, I think it's just having that conversation. And it's important to note that people living with HIV were included in the clinical trials, but we still are waiting for that safety data. So over time, we will begin to get that information. And it's just also something to note that there's a potential for reduced immune responses to the vaccine for people that do have a weakened immune system. I don't know if you wanted to add anything to that, Holly? No. Okay. And then for people that have autoimmune conditions, similarly, you may receive the vaccine. And unfortunately, there are no data that are currently available on the safety of the vaccines for individuals in this particular group. People that are from this group were eligible for enrollment in the clinical trials, but it doesn't seem like they may have been any represented, but they were eligible for the enrollment. Now, what about allergies? So there's a couple of slides regarding allergies, and this was one of the concerns that I had in terms of if I was going to receive the vaccine, because if I'm working at the testing site, at one point we were literally testing 800 to 900 people a day, and so it required our staff to standing kind of in line with people, trying to be socially distant with them, helping them register for the test using their smartphone. So, a lot of contact. So I knew I wanted to be vaccinated. I do have a shellfish allergy and I have an EpiPen. So my whole research was like, oh my God, what is this whole thing on allergies and what do I do? Can I do it? Can I get the vaccine? So a couple of things. So you may have heard that some people may have a severe allergic reaction to the vaccine, and that will be anaphylaxis. And that's basically where a person would be treated with epinephrine or an EpiPen, or it's so severe that they have to go to the hospital. In the event that you have had a severe allergic reaction to any of the ingredients in either the Pfizer or Moderna vaccine, it's recommended that you should not get either of those vaccines. And I know, Holly, you can probably provide more information regarding if there are certain special cases regarding that, but this is what's recommended by the CDC. And in the event that you've had a severe allergic reaction after getting the first dose of the mRNA COVID vaccine, that the CDC recommends that you should not get the second dose. As I had mentioned, based on my own experience, if you carry an EpiPen for food allergies, bee stings, so forth, you're still eligible to get the vaccine. And then there's a possibility some people may have a non-severe allergic reaction, and that would be hives, swelling, or maybe some wheezing. So similarly, if you have an immediate allergic reaction to any ingredient in the vaccine, as CDC recommends that you should not get either of the vaccines. And if you have an immediate allergic reaction after getting the first dose, it's recommended that you should not get the second dose. And if you have experienced immediate allergic reaction, your doctor may refer you to see an allergist specialist or immunology specialist to get more, advice and some more care regarding that.
So, and this is kind of subjective. We've had people that got lightheaded and had to lay down, or, maybe blacked out, and a lot of that sometimes can be, or their, heart rate went up. And a lot of that can actually be attributed to the anxiety of actually getting vaccinated. And so in individuals that, we might have had to have, the EMTs or the emergency squads attend to, most of them we did revaccinate. We just asked them to provide a doctor's note saying that it was okay for them to be vaccinated. There was a very small number that had a reaction big enough that we recommended that they don't get vaccinated again. So most people are able to get it even with mild reactions after getting the first dose.
Thank you.
Penta, there's another question, actually two in the chat. When you were talking about pregnancy, with the current studies, when will they know more in terms of the safety of the vaccine as it relates to pregnant women?
I'm guessing that, from individuals who were pregnant that got the vaccine, the reporting system that I talked about, being able to follow up with those individuals. So it will take some time regarding that.
And then the other question is, someone just had their second shingles vaccine, and their COVID vaccine is scheduled for 3 weeks after that. Is that enough time in between the vaccines?
That's enough time. We recommend at least 2 weeks in between that time, so the 3 weeks should be sufficient. It's a great question. And that's with any other vaccine as well.
Thank you.
Okay, so then in terms of other allergic reactions, and this is for individuals who may have experienced an allergic reaction to other types of vaccines. So whether they've had a flu vaccine and had some allergic symptoms, basically ask your doctor if you should get the vaccine, and then have that conversation, and the doctor will help to decide if it's safe for you to get vaccinated. And again, they can also contact the vaccine clinic to kind of ask those questions as well. And CDC recommends that people that have a history of severe allergic reactions that are not related to vaccines or injectable medications such as food and latex allergies, venom, environmental, that it's okay for them to get vaccinated. And then people that have a history of allergies to oral medications or a family history of severe allergic reactions may also get vaccinated. For myself, when I got vaccinated, I made sure that I talked to them about my EpiPen. And even though I've been allergic, almost 20 years now, I think, to shellfish, I carry an EpiPen. Thank God I have not had to use it, but I felt that information was important. I had my EpiPen with me just to be on the safe side. But one thing about it, the vaccine clinics, they do have all types of different, medical equipment. They'll have EpiPens and all types of different things, as Holly mentioned, and EMS staff on board in case someone does have a severe reaction that they need to attend to. And this is our last allergy slide. So this is basically related to allergic reactions to PEG, which is polyethylene glycol, or polysorbate. So polysorbate is not an ingredient in the vaccine, but is closely related to PEG, which is in the vaccine. And so the recommendation, because they're so closely related, is that if you know that you're allergic to PEG or polysorbate, that you should not get the mRNA COVID-19 vaccine. And again, a reminder about the monitoring time after you get a vaccine. If you don't have any history of allergies and so forth, or allergic reactions, you wait at least 15 minutes. And if you do have a history, then you're monitored for 30 minutes after getting the vaccine. So I was one of those people that waited for 30 minutes, which was fine, just to be on the safe side. And so where can you go for more information? And I think that's one of the reasons why we're having this discussion, is because there's a lot of information that's floating out there. When in doubt, go to the CDC website. The link that I provided there, they have a page on myths and facts, and also frequently asked questions is updated regularly. And in the event that you can't remember this website, if you Google CDC COVID facts, it will take you to that link. So there's a lot of great information there. It's broken down in plain terms, and so a wealth of information, and it will help you to be able to know what's factual and what's a myth. I think the next slides are Holly's, unless there's questions in the chat.
Yeah, there's a question. In terms of people who have an allergic reaction and cannot get the second shot, how will they be protected?
So with that, and Holly can probably add more to this, the first shot, they will have some protection. They won't have as much protection because they would not have received the second shot. And like everyone else, regardless of if you get the second shot or not, continuing to wear a mask, wash your hands, and practice social distancing. So I think with that, at least there's some protection versus none. But that's a way to add further protection, because it's a combination of all those things to protect yourself from COVID.
And with both vaccines, the latest data actually suggests more protection after the first dose than they initially thought. So that is good news as well. But it's similar to any other vaccine, and why it's important then that everybody around that individual get vaccinated, because you kind of cocoon that person and protect them by everybody else being vaccinated as well. And so that's why it is important to try to get as many people vaccinated as possible, so we get to that herd immunity level. So then those that are not eligible to be vaccinated or cannot be vaccinated for multiple reasons are then protected, because those around them are vaccinated.
There's also a question in the chat, and pardon me for not being able to pronounce this correctly, about dysautonomia. And if you already have it, can the vaccine actually make it worse?
So I'm not sure that I can answer that question.
I'm not either.
But what we can do is if you save the chat, or if that individual, we can, share an email address, or if they want to send it in, we can circle back with our medical director to be able to answer that question.
Does it matter if you are on IVIG when you get the shot?
I'm not familiar with what IVIG.
Okay, it's the same person, so we'll circle back to that individual.
Okay, awesome. They can just include that in the same email.
Okay. We already talked about 90 days, the 90-day wait. If you've been directly exposed to many people with COVID on the job, does that mean you actually have some kind of immunity?
Well, if you become infected with COVID, yes, you do have some natural immunity. What we do know is that the natural immunity does not last as long as the immunity that you would get from the vaccine. So again, even if you test positive for COVID, we still recommend that you get vaccinated, because even though we don't know how long the immunity from the vaccine will last, we do know that it's longer than the natural immunity that you would get from being infected. And since, there's a likelihood that you can get reinfected with COVID, we recommend that you still get the vaccine.
Okay. I'm going to ask Kelly to speak to what people can expect when they go to a mega site to get their vaccination.
Hello, can you hear me?
Yep. You're good.
Okay. So when you go to the virtual mega site, it's a well-oiled machine. You get there, there are National Guard there. There's a plethora of staff there. There's someone to take you from, you know how if you go to an amusement park or Disney, there's like this maze, so that, because sometimes people, in the beginning, people were standing outside, so we needed to make it more of an area for you to come in and be able to wait in line. So you go through this maze and you register. People are asking you questions along the way. The National Guard is there to help you get to the vaccination stations. It takes about less than 5 minutes from the interview to your injection time. And then you go wait either to 15 to 30 minutes, depending on what your, if you have a history of allergies. And then you're out the door. When you're actually sitting there waiting for any reaction, they will help you to register for your second shot if this is your first one. And then you are all set when you walk out the door with your date for your second shot. So it is a well-oiled machine. Like when you go there, you will actually, you will have no questions.
Okay. And earlier, Holly shared her side effects with the vaccine. I'm going to ask the rest of our panel to share their experiences after getting that second vaccination, because again, everybody reacts differently.
Anyone just chime in?
Yep. Anyone just
Okay.
chime in.
No
Hear from all
problem.
of you.
So I got my second shot around 1 o'clock in the afternoon on a Friday, and I went to bed around 10 o'clock. I was fine, just had the soreness in my arm, and about 2 a.m. I had chills, I couldn't sleep, and I got up, checked my temperature, I had a fever. My fever ended up getting to about 100 or 101. I had a headache that would not quit. It was a pretty severe headache that lasted all day. And, you know, the body aches, chills. But I would say about 5 p.m. that Saturday, my fever was gone. The only thing that lingered was my headache, but it was not as severe as it was. I went to bed about 7 p.m. Saturday night and slept till 7 a.m. on Sunday. And when I woke up, it was almost as if nothing even happened. Like I was pretty much back to 100%. So it was
So
a
the
lot.
vaccine did its job in you.
It did its job. So I am good.
Okay. Kelly?
You're asking me for my experience?
After the second shot.
Okay, I didn't have a bunch of side effects as Zapinda had, but I did feel like I was coming down with something. That's it.
Okay.
I felt like I said, okay, something's going on. And I knew that it was my body reacting to, you know, the vaccine. Something's going on, but I didn't have like the chills. I didn't have a lot of the side effects.
Okay.
And I carry an EpiPen. So again, that just goes to show that it is different in everybody. I carry an EpiPen for shellfish allergy as well.
Okay.
But I did feel like I was coming down with something. I laid down and went to sleep, and I woke up, and it, like, within hours, it was like nothing ever happened. I was back to normal.
Okay. Elder
And
Dunham.
I'm sorry,
Oh,
real
go
quick.
ahead.
I'm sorry, real quick. I forgot to mention I was pretty nauseous. So chicken broth and crackers were my friend. So I was good after a couple hours.
Is it recommended to take Tylenol or Motrin to assist with the side effects? I've heard different things about that, and someone did just put that in the chat.
I'm not sure if it's recommended, but I can tell you at the mega site, there's some packs of Tylenol when you're walking out the door. I took my Tylenol with me when I was walking out the door.
Okay.
Mhm.
Elder
There
Dunham,
has been some things written about maybe taking certain over-the-counter pain relievers after, making the vaccine less effective, not effective. But haven't seen anything definitively studied that says that that happens. So if you're that uncomfortable, take the medicine and make yourself comfortable.
Thank you. Elder Dunham, what was your experience after your second injection?
I think similar to what I've heard. Pretty much just didn't feel good. Didn't have much of a fever or chills, but just didn't feel well, and I had a massive headache. It seemed to last anywhere from about 36 to 48 hours of just a massive headache. And I just felt a little bit lethargic or what have you. So I kind of planned for that. I took the necessary time off of work, and I slept. And I'd say about 2 days, maybe about, a day and a half, 2 days, I started to feel like myself again. So just a headache and just low energy, didn't feel that well. But that was pretty much the extent of it.
Okay.
Sore arm on the first one was much worse than the second one. I don't know why that was. I had my arm was very, very sore for like about 3 days on the first shot. I don't know why. And the second shot wasn't nearly as bad. So as far as the injection site.
Thank
You needed
you.
me to give you your first shot then.
We have to find the vaccinator when we go get our vaccine. Kelly, I'm going to tell you my date later. Make sure you're there. A question in the chat about the Johnson & Johnson vaccine. Why is it only one shot, and what makes it so different?
So it's just the manufacturing and the different technology that's being used. I can look. I don't believe it's an mRNA, but it's just produced a different way than the other two vaccines were. The efficacy right now, thought I had written it down. I believe it's somewhere between 75 and 85%, depending. And with that, the initial, because the EUA is not distributed yet, we haven't been able to fully read all the information about it. But the initial things that I have read, that it takes 28 days actually to give you that full protection. So almost about the same amount of time. But it is about the same percentage in terms of preventing severe disease and hospitalization as well.
Okay. We have a number of questions coming in. I'm actually going to ask the panelists to take a look at the Q&A and any answers that you can give in the typed answers, just to make sure we meet the needs of everybody, because we are running short on time. There is a question in the chat about masks. How does a common mask slow a virus particle? Are there masks used in lab environments where viruses are actually worked with?
You mean for the masks to be tested? It really comes down to whether a disease is spread by airborne or droplet particles, or how, it's spread. And that is what is studied. So you've seen the pictures of somebody sneezing and all that kind of fluid and droplets coming out of their mouth and their nose, where, if you put a mask in front of that, that's going to stop that from spreading to the next person. So that's how they really study those types of things, is whether it's droplet or aerosolized. They're not usually actually spreading the virus in the lab to be able to test the mask, but they know that it's spread in droplets when you sneeze and you cough. And so they can replicate that kind of size particle and use different masks and different prevention methods to look at how it decreases the spread.
Okay. And Kelly, at the mega site, please confirm that you do have to have an appointment. You just can't show up. Is that accurate?
That is correct. You do have to have an appointment, and you will be checked as soon as you come through the door. So you won't even be able to get into the mega site if you don't have an appointment, if your name is not, if they can't verify your name.
And
Okay.
I typed in that Q&A box the link to register at the mega site.
Okay, thank you. What is the recommended wait time for the vaccine if you've had an exposure or infected? Was that 90 days?
For if you've been exposed and you're under quarantine, you just need to wait till you're out of your quarantine period. If you've been positive, there's really all you have to do is beyond your isolation period and not being symptomatic to get vaccinated. So you can get vaccinated, as long as you're not infectious. But if you are uncomfortable getting vaccinated right away, then they say you have up until about 90 days because the body probably has some natural immunity during that time period.
So there is a question in the chat about schools and whether our students will ever be able to go back for 5 days, full days again. And basically, us in Burlington Township, I'm going to encourage all of our community members to check our website. We are always communicating with our community members about what we're doing with the path forward. And we have a lot of detailed information that is continuously being updated as it becomes available for our community members as it relates to Burlington Township. For those of you who are not in Burlington Township, I would just urge you to have conversations with your own school districts to find out what's going on so that you can stay informed. One thing I can say is that we all know that we will get to the other side of this. We are not going to stay in this place forever. There is the other side of through, and we just have to just stick together and do what we have to do to get through that. Someone else just put in the chat, how come the FDA lists potential fertility issues and pregnancy outcomes as a negative effect on their website? Does anybody have any answer for that one?
I don't. The CDC just posted the fact sheet about vaccine and pregnancy. So there is an FAQ about vaccine and pregnancy on the CDC website.
Okay. Is there a website for people to check out the percentage as it relates to adverse effects of the vaccination?
I know that they're currently collecting the data. And typically the data is reported out in the MMWR, the Morbidity and Mortality Weekly Report. So when they finally get enough data, now the data is available for the clinical trials. On that full emergency use authorization, they do list out the side effects that were experienced during all the clinical trials and the percentage of each. So that data is available on the clinical trial data. But currently, through that VSafe application that Zupenda was talking about, they're collecting data from everybody else that was vaccinated that volunteers their information. And usually after a couple months, they'll take that data and they'll report out on it. I mean, if you think about it, we're really only about 2 months into the vaccine process, with vaccines beginning in mid-December. So there's still a lot of data that they're getting, and then it'll take them time to analyze that data.
Someone has a just curious question. How do they test that a shot is 95% effective?
So that's done during the clinical trials, and it's tested different ways at different phases. So the phase 1 trial is usually all about safety. And is the vaccine even safe to move forward to the next phase? With the phase 2, they'll start to look at antibodies. Are there antibodies produced, and what level of antibodies are produced? And then usually in the third stage, that's when you have the randomized control trials. So you have people in a study that get the vaccine, and you have people in the study that don't get the vaccine. And you look over a course of time of, did they get COVID? And if they got COVID, did they have the vaccine or did they not have the vaccine? So it takes into a bunch of different methods during each phase of the clinical trials.
Is there any data on the effects of someone accidentally getting a spoiled or out of date vaccine?
I don't think so, because we haven't had any out of date vaccines yet. Most of the vaccines that have come out now have expiration dates down, May, June, July. If they're kept frozen, once they're out of the freezer, it's a different story. But I can tell you the vaccine management side of it, in terms of, how often we have to check temperatures. We have data loggers that record them all night. Once they're taken out of the, fridge or freezer, how long we have to use them. And at the end of a clinic, you're not allowed to save any. So once you open that vial, you have to use all the doses in that vial. So that it's not like you're carrying one over to the next day. So there really is little opportunity for that right now. Once we get down the road and vaccines actually are reaching their expiration dates, that'll, have to be looked at.
Do you know if there are a lot of 17-year-olds getting the vaccine, and how many kids at that age were studied?
So the Pfizer is approved for 16 and older. So it would only be those in the Pfizer study. Moderna is only approved for 18 and older. So for 17-year-olds, they would only be eligible for Pfizer. I don't know how many were included in the clinical trial. I'd have to go back and look specifically at the EUA. I can tell you the next group that's being studied right now is 12 to 15. The 12 to 15 are currently, 12 to 18 for Moderna and 12 to 15 for Pfizer are currently in their clinical trials to determine the effectiveness among that group of that age group. From what I've read and heard, the hope is that by summer, that age group would be approved to be able to be vaccinated as well. The 12 and under are going to take time, because the smaller they get, you then have to start adjusting dosages and looking at, can they take a full dose? Do we have to increase it? Is it weight-based? A bunch of other different things. So they'll take a little bit longer to study than the 12 to 15-year-old.
And then there was a question about 5-year-olds. Why not look at this for kids who are 5 and over?
It's just the clinical trials are much more difficult in children. One is finding the number of volunteers to be able to, run a clinical trial on children that young versus, the older individuals. And then it comes down to dosage as well. We know with certain vaccines and certain medicines, we have to cut the dosage based upon size. So it takes a bit more time and safety watching when you're doing clinical trials in children.
And someone wants to know, do you recommend the vaccine for children in the 17 age group? Would you give it to your child?
I would.
All right. Well, we are at the 5-minute mark. So we're a little bit over, and I want to thank everyone. We had other questions, and we could probably sit here for another 2 hours and talk. But I do want to give our panelists an opportunity just to say some closing words, give a closing message to the community that we have tuned in about the vaccine and what should we do. We're going to start with Supenda.
Hi. I would just say continue to, like I said, use those reputable sources. And I really like these types of conversations because many times we feel like we know what the questions are, and actually hearing from the community and engaging will help us to know what are some things we may need to address, or maybe different educational materials we need to put out there. So this is very important, and continue to ask those questions and ask us. Even though we get a lot of questions, it just helps us to keep us on our toes and making sure that we have the answers as much as we can and providing that information. And, share the reputable sources that we have, that we share on our Facebook page, our website. We even have a mobile app, and we keep it regularly updated with different updates and information. And we get that information from the New Jersey Department of Health COVID vaccine site, as well as CDC.
Thank you, Zapinda, and we really appreciate you being with us tonight. Our
Thank you. It's my
vaccinator,
pleasure.
Kelly, what's your final word for us?
I just really want to say that I learned a lot today as well. So even though I'm a health professional and very deeply involved in the COVID vaccine and being a vaccinator, I learned a lot from Zapinda and Holly. Thank you so much. I think I would say having lost loved ones to COVID and having a daughter in college who just finished getting over COVID, very near and dear to my heart. Everyone listening, or I'm sorry, looking, listening, and on this panel will know someone who has been affected by COVID. We have, throughout the history of our time, eradicated many diseases through vaccines. Of course, you need to do what is best for your family, but as Zapinda said, look for the facts, trust the evidence, go on reputable sites. Social media, everybody knows everything on social media, but just make sure that your sources are credible and reputable, and be safe.
Thank you so much, Kelly. We loved having you with us this evening. Dr. Holly, what's your final word?
So my final word is, I guess, when it comes to the vaccine is patience. Right now, there is not enough vaccine to meet the demand. And it is, a good thing, but also a bad thing because there's a lot of frustration out there. But more vaccine is coming. And we are going to get it to everybody that needs it, whether it's an appointment at the mega site, your local pharmacy, or we come to your community, which is our plan, to try to meet people where they are, to get them vaccinated. So have some patience. We're getting there. We knew vaccine supply would be limited in the beginning, and that's exactly what we've seen, and more is coming. And we will get there. We will get it to everybody that needs it. And so if you're on the fence about getting vaccinated, you can contact the health department, contact your physician, and go to those trusted, reliable websites for information.
Thank you. And thank you so much, Holly, for being here tonight. Elder Dunham, what is your final word?
I too, certainly appreciative to all of the contributors tonight. I learned so much. And I think that's just the nature of where we are. We are continuing to learn so much about this virus, about this vaccine. And I know there's a lot of concerns about the long-term effects of things, but I like what Holly said in terms of you just measuring the benefits versus the risk. And certainly I feel that the benefits outweigh the risk. And so I just want to strongly encourage everyone to carefully consider, as has been said, with those reputable facts, and make sure that you do your own personal research. But the information that has been provided tonight has just been so profound and so thorough. And so thank you so very much. And so I want to encourage everybody to, we are a community. If we have learned anything about this virus, is that we interact with one another, and it's so easy to spread something that's harmful. And so by being vaccinated, you not only protect yourself, but you protect those around you. So please do your best to do that if you can. Thank you.
Thank you, Elder Dunham. We really appreciate you being here with us this evening. Katina, what's your final word for tonight?
Just want to thank everybody, all the panelists, because I definitely learned a lot by listening to you all, which was super helpful for me and my family. And I just want to make sure everybody stays safe. And like Elder Dunham said, just, protect yourselves, protect everyone around you. And thank you all for coming tonight.
And to all of our attendees and to our panelists, I just want to thank everybody for being here with us and joining us on this journey of critical conversations. For those of you, if you still have questions, I would encourage you to email them to us. All of the participants did receive a link where you could submit questions. I would just say, when you submit your questions, be sure that you provide us with your email address so that way we can share it with the panel. The panel has access to the sheet where all of the questions are being dropped, and that way we can get answers to you. Knowledge is power, and it's important that we not take things that are on Facebook, things that are on Instagram, Twitter, to be the whole truth and nothing but the truth. It is important that you do your own research. It's important that you speak with people who have answers and just don't take it for what it is. Do your research and just don't accept what people post to be the truth. So it's important that we work together in order to move forward, because that's what it's about at this point, doing what we can as a community so that we can move forward. So again, I want to wish everybody in attendance tonight all the best, good health, and remember, there is the other side of this. We will get through it together. So remember to stay safe, socially distant, mask up, and please consider getting vaccinated. Sending everybody the Wakanda hug. So thank you, everyone. Have a good night, and thank you for coming.